Part 2 of Chapter 13 will go into different hormones released by the endocrine glands. So here we're starting with the anterior pituitary on this slide. Know what these hormones are releasing, or what these hormones do. The growth hormone, this is important for muscle and bone growth, increases protein synthesis, which is important for muscle and bones to get thicker, stronger, and also regulates fat usage. Prolactin, this leads to milk production. Thyroid stimulating hormone, also called TSH. This leads to the release of thyroid hormones. So it goes to the thyroid gland, activates the thyroid gland. So then we'll see that the thyroid gland is then able to release its own hormones called T3 and T4. Adrenocorticotrophic hormone, this is also called ACTH. This one then activates the adrenal gland. So it stimulates the secretion of cortisol and other glucocorticoids from the adrenal cortex. Cortex meaning the outer layer of the adrenal gland. Follicle stimulating hormone. This stands for FSH, also called FSH. This leads to growth and development of ovarian follicles, which contain the eggs, but also it's important for sperm production. Then the luteinizing hormone, or LH. This causes ovulation and sex hormone production in both genders. So production of estrogen, but also testosterone. If there's an issue with the anterior pituitary, the growth hormone release may be disrupted or increased. Hypopituitary dwarfism, this is caused by deficiency of growth hormone during childhood. So it leads to a short stature, even though body proportions meant to development aren't normal. And so here the treatment would be to give growth hormone to the child. But it must start before the bones completely finish fusing. Gigantism, this is then caused by oversecretion of growth hormone during childhood. And so here the height may exceed 8 feet. And this is usually caused by a pituitary gland, pituitary hormone. Acromegaly, now this is caused by an oversecretion of growth hormone during adulthood. No increase in height, but the bones can end up thickened. And so here you might see enlargement of the tongue, nose, hands, feet, jaw, heart, and thyroid gland. Next, for the posterior pituitary, once again, it does not produce its own hormones, but it acts as the region where the hypothalamic neurons are releasing their hormones. 2 hormones are produced by the neurons in the hypothalamus, stored by the posterior pituitary. And so they're being transported using the infundibulum. So the infundibulum just meant the connection between hypothalamus and pituitary. This is also where the blood vessels, the hypophyseal portal system, end up moving. So here, one of the hormones, antidiuretic hormone, or ADH, also called vasopressin. This leads to water reuptake in the kidneys and causes vasoconstriction to increase blood pressure. Oxytocin, this one causes uterine contractions during childbirth, but also milk ejection. Next, thyroid gland. Thyroid gland has 2 parts to it. The middle connection part is called the isthmus. So this is just below the larynx. So here, the thyroid gland needs iodine to make its hormone. There are 3 different types of thyroid hormones, T4, T3, and calcitonin. Follicular cells we're going to see. these produce T3 and T4. But then the extra or the parafollicular cells, these are the cells around the follicular cells, they produce calcitonin instead. And so here this picture is showing inside the thyroid gland are these circular regions. These circular parts are surrounded by follicular cells, and the inside part is called the colloid. And this is where the hormone is being deposited by the follicular cells. Extrafollicular cells, or the parafollicular cells instead, those are outside the follicular cells. These are making calcitonin instead. Okay, so then know that T3 and T4, these two thyroid hormones, they increase metabolism, increase protein synthesis, important for growth and development of the nervous system. But T3 and T4 require iodine in order to be made functional. Goiter is caused by low iodine in the blood. What's happening in order to cause a goiter for the thyroid to become enlarged is that the follicular cells, when they don't get iodine, they think that they're not making enough thyroid hormones. They're not making enough T3 and T4. So they keep on making more and more. And so the colloids, these circular regions, end up becoming enlarged. So imagine if each of these get larger and larger, the thyroid gland ends up becoming larger as well. Okay, but so know that the goiter, low iodine, that's the cause. Versus calcitonin, this one reduces calcium level in the blood by causing calcium absorption by the bones. Here are disorders associated with the thyroid gland. Hyperthyroidism. So this means that the thyroid gland is releasing too much of the hormones. This leads to high metabolic rate, sensitivity to heat, restlessness, hyperactivity, especially in weight loss, and it can also lead to protruding eyes and goiter. Graves' disease. Here, this is an autoimmune disorder. Here, the antibodies, autoantibodies meaning against self, they bind to TSH receptors on the thyroid cell membranes. So here, this mimics action of TSH. So here, it's overstimulating, it's overactivating the gland. And so when this happens, the gland ends up releasing a lot of the hormones. Okay, versus Hashimoto disease. It's also with autoantibodies against self. Here, they destroy the thyroid cells. Hypothyroidism. Infantile would lead to stunted growth, abnormal bone formation, intellectual disability, sluggishness. Versus hypothyroidism in the adult. This reduces the metabolic rate. Can also lead to sensitivity to cold, sluggishness, poor appetite, swollen tissues, mental dullness. Versus then the goiter. So this meant due to iodine deficiency. Here are pictures showing the infantile hypothyroidism, then Graves' disease. So here we can see somewhat of the protrusion of the eyes and the goiter, and also simple endemic goiter. Parathyroid glands. These are located on the back side, posterior side of the thyroid gland. Usually there are four of these. And so the parathyroid glands release the PTH, which stands for the parathyroid hormone. Know that PTH increases calcium level in the blood. And so here PTH is able to increase the calcium level in the blood by causing the release of calcium from our bones. And so here, yes, the bones end up becoming weaker. but at least the calcium can then be sent to the organs that need it. Okay, so this leads to bone breakdown. Also, PTH leads to the activation of vitamin D and sending the calcium back to the body. So calcium absorption by the kidneys, and also PTH leads to calcium absorption by the intestine. So here I'm going to list these. PTH leads to bone breakdown, and calcium absorption by kidneys and intestine. Hyperparathyroidism. This can lead to fatigue, muscular weakness, painful joints, altered mental functions. Usually the cause is due to a tumor, and so treatment would be to remove the tumor. Hypoparathyroidism, this can lead to muscle cramps, seizures. So here, low PTH secretion reduces the osteoclast activity. Next, the adrenal glands. These glands are located on top of our kidneys. We have two of those. Adrenal cortex versus the adrenal medulla are the two different regions of the gland. The cortex is the outer part, and the medulla is the inside part. And so here, this picture is showing the adrenal cortex. This is the outer region. This part makes steroid hormones. Versus the adrenal medulla, this is the central portion of the gland. This one releases immune hormones. Okay. First, the adrenal medulla and the two hormones that it releases, epinephrine and norepinephrine. What do those do? These increase the heart rate and blood pressure, increase respiration, increase blood glucose level. Adrenal cortex, the outer part. The cortex itself has different layers to it. Zona glomerulosa, this is the outer part. This is the region that makes aldosterone and other mineralocorticoids. Zona fasciculata, the middle part of the adrenal cortex. This part makes cortisol and other glucocorticoids. Then the zona reticularis, this is the inner part, and here male sex hormones or androgens are produced. Well, what do these hormones do? Aldosterone, this one leads to sodium reabsorption by the kidneys. And so when the sodium is reabsorbed, water is also reabsorbed, meaning sent back to the body. So sodium and water reabsorbs because of aldosterone, but instead potassium is secreted or excreted. So potassium is then sent into the urine instead. Cortisol, this one increases blood glucose level, decreases protein synthesis though, but reduces inflammation. And so this is released in times of stress. Androgens, these aid sex hormones. Disorders of the adrenal gland. Addison's disease. Know that this is due to hyposecretion from the adrenal cortex. So because not enough cortisol, aldosterone is released, this results in electrolyte and glucose imbalances. In dehydration, because aldosterone led to sodium reabsorption and therefore water reabsorption, and so not enough water going back to the body from the kidneys. This can then lead to low blood pressure, fatigue, nausea, increased skin pigmentation as well. It can be fatal if the electrolyte level is not balanced. Cushing syndrome instead is caused by hypersecretion. So now this is the opposite with the Addison. This is hypersecretion of cortisol. So too much cortisol can lead to muscle wasting, meaning muscle breakdown. It can also lead to loss of bone, elevated blood glucose, because that's the job of cortisol, to increase glucose levels in the blood. This can also lead to sodium retention and water retention. And so when these increase, then it can lead to increased blood pressure as well. Now the person may have puffy skin and also adipose tissue just build up in the face and the back. Next, the pancreas. Pancreas has two functions to it. It has its endocrine and exocrine. Endocrine because it releases hormones into the blood vessels that are around, and exocrine because it uses a duct to release the digestive enzymes that it makes. So here we're going to cover the endocrine function. Exocrine function of it will be covered in the digestive system chapter. The hormones released by the pancreas in these special cells are glucagon, insulin, and somatostatin. Know that the alpha cells release the glucagon, beta cells release insulin, and delta cells release somatostatin. Here this picture shows the pancreas. It's an elongated, flattened organ. It's below and to the back of the stomach. Inside the pancreatic ducts, which we're going to cover in the digestive system chapter, this carries the digestive enzymes over to the intestine. But inside the pancreas, there are these special groups of cells called pancreatic islets, and so this is where the endocrine hormones are made. Well, what do these hormones do? Insulin, this one decreases blood glucose, and so insulin is released after a meal, and insulin causes glucose to go into our cells. Glucagon, this one increases blood glucose, and so this is released when hungry. And so this leads to the breakdown of glycogen into glucose, and then the glucose is sent to the bloodstream to go to your organs, especially to your brain cells that need glucose. Somatostatin, this one regulates glucose metabolism by inhibiting secretion of insulin and glucagon. Two types of diabetes, type 1, type 1 DM, diabetes mellitus. This is also called juvenile or insulin dependent. Know that this one is an autoimmune disease. Here the immune system destroys the beta cells of the pancreas. So this results in a lack of insulin production. Versus type 2 diabetes, this is maturity onset. Here insulin is produced, but body cells are unable to recognize it because here the insulin receptors become non-responsive to insulin. And so here, insulin's job is to bring glucose into our cells. So if these receptors don't respond to insulin, glucose is not able to go into the cells. Treating these two types requires the administration of insulin for type 1. And so it can be obtained from pigs or cows, or it can be synthesized using bacteria. With type 2 diabetes, here changing the diet and exercise, low carbohydrate, high protein diet, regular exercise, gastric bypass surgery may be recommended. But also administering insulin can also be done with type 2 diabetes. Some of the other glands, pineal gland, this releases melatonin. This is important for day-night cycles or circadian rhythms. Important for day-night cycle. Thymus gland. This we're going to cover in more detail in the immune system chapter. This releases thymosins. So this one is important for developing T lymphocytes. Reproductive organs. Ovaries produce estrogens and progesterone. Testes produce testosterone. Then the placenta, we'll cover in the last chapter this semester. Placenta produces estrogens and progesterone. Other organs, when we get to the digestive system or talk about the heart and the kidneys, we're going to go over some of those hormones made by these organs as well. Stress can lead to changes inside the body. So what happens is hypothalamus activates sympathetic nervous system in terms of stress and increases secretion of adrenal hormones. Well, there are actually two different types of stress. There's psychological stress, which would be if you're feeling like you're in danger, personal loss, anger, fear, guilt, but physical stress as well. Temperature extremes, so sympathetic nervous system would also become activated during this, or during infection, injury, and O2 deficiency. Okay, so in all of these conditions, sympathetic nervous system becomes activated. Also, when the hormone levels then increase because of the sympathetic nervous system, it leads to changes. Adrenal medulla releases more epinephrine and norepinephrine. Well, when those increase, it leads to high blood glucose. If there's too much glucose in the blood, it can lead to plaque buildup. Also, blood fatty acids increase, heart rate increases, blood pressure increases. Breathing rate can also increase, pupils dilate. While also cortisol ends up getting released in times of stress, in addition to epinephrine, norepinephrine. Cortisol also increases glucose levels in the blood. Release of fatty acids as well. And also glycerol can be turned. Glycerol is the component of fats. It can be turned into glucose as well. And so all of these then lead to high blood pressure, high heart rate, and it can lead to stroke or heart attack. As we get older, our endocrine glands may decrease in size. Muscular skeletal strength decreases because growth hormone levels decline. ADH levels increase due to slower elimination by liver and kidneys. But as with some of these other changes, calcitonin levels may decrease, PTH level changes. And so basically, as we get older, our glands end up releasing lower amounts of the hormone.